Welcome to the body imaging cases. Here is an incidental finding of a solid lesion of the left adnexa in a 58-year-old lady. The lesion has been described as ovarian on contrast-enhanced CT and also on transvaginal ultrasonography, suggesting a malignant ovarian neoplasm. On MRI, a couple of findings suggest that this malignant neoplasm is tubal rather than ovarian. First, here we see the lesion embracing the left uterine horn, which is more likely in tubal lesions than ovarian lesions, which tend to displace rather than embrace this part of the uterus. Second, we see here the two layers of the broad ligament of the uterus. The anterior layer displaced forwards by the lesion and the posterior layer breached and passed through by the lesion. The tube is located within the two layers of the broad ligament. The ovary, on the other hand, is located on its posterior surface. Third, we start here to identify the left ovary itself. Along the lateral aspect of the solid lesion, with its low signal intensity cortex and slightly higher signal intensity medulla, and two tiny follicles in this 58-year-old lady, there would have been a chance to identify more follicles, of course, in a younger patient. Hysterectomy and bilateral salpingophorectomy has been done and shown adenocarcinoma of the left fallopian tube. So the diagnosis here is adenocarcinoma of the left fallopian tube. And the learning points are identification of the malignant neoplasm in the present case as tubal rather than ovarian, rested on the relation of the tumor to the uterine horn, the relation of the tumor to the two layers of the broad ligament of the uterus, and the identification of the left ovary itself separate from the tumor.